Well, good morning, everyone. Thank you for joining us today. This is our first community update since the end of last semester. So there's a lot that's taken place. So we have actually a lot of slides to share with you. There's an incredible amount going on at the university right now. And I think it's important to be able to update you on some of the things that we're making progress on. Before we move forward, though, I do want to recognize that we've just started our academic year. So welcome to the class of 2028. Most of them are sitting in classrooms or off studying right now, so we didn't expect a lot of student participation today. But we are at a record number of students once again at the university. 192 new medical students, 65 new pharmacy students, and last count we'll have 88 new graduate students at the university. So we continue to grow. Yes, thank you very much. Continue to grow. And our students are thriving and doing well. We've also been noted by U.S. News and World Report to once again be a best grad school in the United States. This is the second year in a row, and those two are really marked the first time that this happened for the university. So this is a big deal. What it means is we're in the top 20% in key categories. And we've been noted to be the number 23 most diverse medical school in the nation, number 2 in Ohio, just a little bit behind The Ohio State University. And we're making progress, and we got them in our targets. And we are continuing to make sure that this university is reflective of the communities that we serve in a way that meets federal and state guidelines. So we're continuing to make great progress as a university. I do want to recognize our great faculty members who do research at this institution. We've not had an update in 2 months, so over the course of that time, we brought in almost $4.6 million in new grants, both state, philanthropic, and federal funding. So these are the key individuals. There's a lot of them now who are continuing to make significant progress and have big impact on our communities, and also to change the way healthcare is delivered through the change in new knowledge acquisition and how we practice. College of Medicine asked me to share that they nominated and then congratulated now professors who were recognized by the first-year College of Medicine M1 students, and next slide will be the College of Medicine M2 students for the high-quality professors who teach them. For the M1s, it was Dr. Jeff Malott, and for the M2s, it's Dr. Jun Yun. Now, all of our faculty are great, so this means that these superstars rose to the top out of an incredible cadre of great professors who look after the best interest of our students and see that they have successful career trajectories here at the university as they launch on into their formal career passions in the area of medicine. We also want to congratulate the Family Medicine Interest Group. They were recognized as a national program of excellence by the American Academy of Family Physicians. So this is a really big recognition for an incredible, talented team of students. And Michaela Stamper, who's an M4, received an American Medical Association Foundation Physician of Tomorrow Scholarship. So real outstanding students being reflected at a national level. Many of you know that with the departure of Dr. Boltry and Dr. Bond, that the free clinic is continuing to thrive, and partially it's because of the incredible team of people who have been running it in its transition along with our students. But we now have a new director of the free clinic, and that free clinic had various names from SOAR to the student-run free clinic, but it is now officially designated with the state of Ohio as the NEOMED Free Clinic. And Dr. Sarah Ismail, who's a graduate from the class of 1994 from NEOMED, is now our new director of that program, and she has been very engaged and very active, and we're expecting an expansion of that program and even greater impact for the communities we serve and greater impact in the educational value that it provides to our students. And many of you have been following the story of our College of Dentistry as it's progressed over the last several years through a very complicated and intricate process to become accredited. Now, about 2 weeks out, we found that we have received full initial accreditation from CODA, and we've received accreditation from the HLC, and we've been approved by the state of Ohio. So we are now actively recruiting new students to the College of Dentistry, the Batante College of Dentistry. The website went live not last week, but the week prior at the end of the week. So we've formally been active for about 10 days, and we have almost 1,000 applicants for the 50 positions that we'll be offering. So clearly an in-demand program, and pretty amazing that we were able to do this. So hats off to Deb Loyette and her team, Rick Hasmer is our consultant, and the entire College of Dentistry team. They've not done this alone. They've had support from the strategy office and from general counsel's office and the entire back end of the president's office, including Mary's team on finance. And this was a big poll and a really big deal for us. So we are now formally launching and accredited our 4th college at Northeast Ohio Medical University, which is a big deal. How many Pittsburgh Steelers fans in the audience? 1, 2, 3, 4, 5, 6. How many Browns fans in the audience? There we go, a whole lot more. Steelers fans, you may want to get up and leave. I'm sorry. Although we're still going through formal signatures, I'm proud to announce that Northeast Ohio Medical University is now a proud sponsor of the Cleveland Browns. We did a deep dive into our brand, into really understanding who the university is and what we do. And through that study, we learned we needed to do more with getting our name out to the community, because the community not only sends us students and benefits from our eventual graduates delivering healthcare, but in fact, the community makes up a large group of potential philanthropic donors to the university, as well as our legislators who have a significant impact on the funding and the steering of this university to meet state needs. And this was found by the marketing team to be the area where we could have the biggest bang for the buck. So we will have a 3-year partnership that should be formally announced outside of the university later this week. And some of the benefits, besides increased recognition, will be radio spots, billboards, signage within the facility itself, digital signage that'll take place during every game, as well as the ability for us to be able to send students, faculty, and staff to some select games that'll take place here at the Brown Stadium. And we're planning watch parties for a few games at the university. One of those will very likely be the Steelers game, since that's going to be so hot and contentious at the university. But this will be really great. It gives our students something to rally behind. We don't have sports teams, as you know. So this is we'll adopt them as our surrogate team, so that the students who want to get involved and get engaged and feel that camaraderie around the university and one of our partners can have a big deal for us. More than just this, though, we're partnering together with them on serving the community, and we'll have at least one, potentially several community events where we're partnered. Our focus will be in education and providing education, especially in underserved communities within our region. So I think this will be really great for us. Now, there are a lot of questions that I've received over the last few months, and some of those we couldn't share until the Board of Trustees met and approved things such as our budget, compensation, some of the renovations we're doing at the university. And I'm really pleased to share with you that we've got a lot of great updates, but I thought it was time that you heard from somebody more than just me, maybe the person who has their finger on the pencil that does the ledgers for accounting. So now I'm pleased to introduce Mary Taylor, our Senior Vice President, Finance and Operations.
Okay, good morning. I'm hoping you can see this. I have a couple of slides. The numbers are small, Rebecca, but I still hope that you're able to see it. So you've heard President Langell mention on more than one occasion about health insurance. So we're right in the process now of seeking proposals for a health insurance for next year. Our current contract expires at the end of this year. So I just wanted to share this slide with you just to give you context of what he's been telling us. So if you look at the very bottom line and you look at the total amount of medical and prescription claims paid, these are actual costs incurred, $6 million. Look at the next line over. So you're now the second column from the right side of the spreadsheet. Total premiums paid, $4 million. So you can see that the costs that we're incurring for healthcare far exceed the premiums that we are paying, both on the employee and the employer side. So when you hear President Langell say that insurance premiums are going up 36%, this is the reason, because of the claims cost. So we've received 2 proposals. We're hoping to receive 2 or 3 more by the end of this week, and then we'll be able to give you an update about the direction that we're going to go with health insurance. But I did just want to put the comments that you've heard him making over the last several months in context. And I hope this helps to explain why health insurance premiums are going up, because our claims costs are high. Again, this isn't the easiest slide to see, but we are going to share with you the budget. This is the fiscal year 25 budget. I'm not going to go through every line item. Many of you in this room participate in the process, and we do truly appreciate that. But our total budget for fiscal year 25 is just over $100 million. So let me talk a little bit about the process. So for those of you that have participated, this is the 4th year that we've done the zero-based budget process. So if you ever have written a grant, you already know what that means. It means you determine what are your goals, objectives, priorities, what are you trying to accomplish, and then what are the resources necessary in order to achieve your goals. That's exactly what zero-based budgeting is. Establish your goals and your objectives, and then make a decision about the resources necessary: personnel costs, equipment costs, supplies costs, and we budget at the lowest level, so at the account level. And again, many of you have participated in this process. Each division ran its own budget process. So I worked with my division, operations and finance. The president's office obviously worked with his division, and the provost worked with the colleges. So once that process is done, then all of those budgets get submitted to the budget committee for review. I think it's really important, because I'm not sure this has been said, and I think it's important that you know this, that the first decision made before we decide to fund any other priority, we look at staff raises. Faculty that participate in the faculty empowerment plan, you know how your compensation is determined. Legacy faculty not participating in the faculty empowerment plan, raises are at 2%. That's been stated for the last several years. But for staff, we make the decision at the outset: what can we afford to do to take care of our most important asset, which is our people? So we make that decision right out of the top. I want you to know, it's interesting. I just got this information over the weekend, and all I think but one public university in Ohio reported raises for the last fiscal year 24 and 25, and we are at the top of the list for providing raises to our top performers. You know, we do staff raises based on performance. And then this is just a pie chart that breaks down total revenue received. And then the next slide is a pie chart that shows you how the expenses are spent. This information is all available. It's all publicly available. So if you have specific questions, you know, just let us know. We're happy to answer any questions that you have. You'll see in, well, maybe you can see again, these are hard to see, but tuition and fees, student tuition and fees continues to be the #1 revenue source for NEOMED, and that's the case for all the other universities in Ohio. And then you'll see just behind that is state aid. And this slide, the pie chart shows the breakdown of how expenses are actually spent. So you can see instruction and department research, separately budgeted research. These are specific categories that we report our audited financial statements. So we show the budget in the same way that you would see the audited financial statements. Again, I know these are probably a little bit hard to see, and if you have specific questions, I hope that you'll ask. We'd be happy to provide you more information. Mandatory fraud training. So you all received an email about 2 weeks ago. We have a new requirement in Ohio. Every one of us, and every one of us that works in any level of government is required to participate in a new mandatory fraud training. So please make sure that you complete your training by October 1st. Every single person has to do this. This will be audited by the auditor of state, and we have to prove that every employee actually participated in this training. It's a short 8-minute video, but please make sure you do that by October 1st. Now, for better news, Space improvement. I wanted to go through, you've probably walked around campus, you see some of the improvements and renovations that we're making to campus to improve the exceptional experience for all faculty, staff, and students. So I thought I would just share with you some of the investments we've made over the last year. Campbell Atrium, thank you, Tanya. You provided us some branding that you probably don't see today, but you are soon going to see across campus more NEOMED branding. And this is what the Campbell Atrium, a picture of what we intend for it to look like after Tanya and the marketing group are done with their magic. The College of Pharmacy hallway, if you've been down that way, we've carpets new, paint. Again, branding is coming. The kitchenette was renovated. It's much nicer compared to what it used to be if you've been in there. And then also the area just outside the Stockdale boardroom. And as Dr. Langell mentioned, the Batanti College of Dentistry Clinic is up and under renovation. If you've walked down there, the spaces are gutted and they're almost basically wide open. So construction started just a couple of weeks ago. They're moving very quickly because we are all excited to accept our first students in the College of Dentistry in August of 2025. The student game room, so the old bookstore, it's sitting kind of vacant right now. If you've walked by that, that is going to be the student game room, and Sandra has been helping with that, and I really appreciate her assistance. So it'll be a new student lounge or new student game room for our students. And it's also in that corridor where our students do spend so much of their time. So it makes sense for them to have their student lounge right there. Also coming soon, the Veterans Lounge. So this is a sneak peek. We will begin working on this. We've got a design, getting furniture ordered. We are looking forward to welcoming military students on campus in November. So the Veterans Lounge will be completed by that November date that we are expecting to receive our students on campus. And I think this, oh no, quiet study space. We are finishing the drawings or the layout for the area upstairs. We are going to renovate the quiet study space to give our students more small group study rooms. It's going to be, I think it's going to be a great space. It's something that I know our students have been asking for some time. So we're really excited about this project. We expect it to start mid-December, and obviously we'll get it done as quickly as we can to cause the least amount of disruption for our students. The medic lab, again, if you've not walked over there, that space looks fabulous. It really turned out very, very nice. We renovated that space with a gift to the foundation, and we're very pleased how this space has turned out. It's going to be a great space to innovate, to collaborate, and become a very important part of the work that gets done by our students and our faculty, and also community members who will be a part of the work that's going on here at NEOMED. And then this is my last one. So again, Tanya, I think you provided this one, so we appreciate that. One of the first things I noticed when I walked around campus years ago, and probably too much still today, we don't have branding. You can be in any number of places on campus, and you ask yourself, where am I? There's nothing that says you are at NEOMED. So I'm so glad this is something that we're finally going to get done. And this is just a sneak peek of what the marketing group is working on to make sure that we have branding that properly informs everyone on campus, and it helps build that community spirit about being here at Northeast Ohio Medical University. So with that, that is my last slide. Thank you.
Thank you, Mary. Just to expound on a couple of things. One, if you look at the data that's been released by the Inter-University Council on raises, Mary was trying to emphasize that we want you to understand how valuable you are to us. When it comes to starting that budget every year, we first say, we want to do this. Let's take that off the top. Whatever's left, that's what goes into other programs and new programming at the university. So we take care of our folks first. If you were to do a comparison and say somebody with a $50,000 a year salary 2 years ago, today at NEOMED, they're making $4,000 a year more than they were 2 years ago. If you're at the University of Akron, you're making $1,000 a year more. And if you're at Youngstown State, you're making $2,000 a year more. So the university has more than kept up with our peer group locally, and our goal is to stay there year over year, promising to get where we need to be. And I think we actually are. We just need to maintain it now. And then that doesn't include the incentive elements that we also offer for those who are interested in doing things outside their job that we think are beneficial to the university. The other piece of information is when you're coming into the university from down near the highway interchange area, if you go by the area where the Cracker Barrel is, there's 11 acres of land that include one of the buildings, not the water building, but the other building you see from the street. That is all now NEOMED property. We acquired that in a very good deal, and we're looking at developing that out over the next few years to add a lot more resources to the campus, to include areas for walking around and getting a chance to mingle with nature, to adding on some additional resources Mary's working on that would provide better food and beverage opportunities that would be open in a much more extensive period of time on the campus. So more to come on that a little bit later. The campus bylaws and policies outline the ability for me to be able to give you extra time off every year. And historically, because you do such a great job, we've awarded it. And as I said before, we'll be the president who didn't give those extra days because I think everybody counts on them now. So we'll be sending this out, but these will highlight what we're going to do around winter break. I realize this is a bit of an eye chart. We do ask you to use a few comp or vacation days combined with 4 winter break days that we're giving so that you'd be able to have December 23rd all the way until a return January 6th. One of the great benefits of being in higher education is taking this time off. Just remember that we do have people like the men in blue in the back of the room and the woman in blue in the back of the room who need to be here at times. So we work on giving them comp time. Same thing with our clinic. Our clinic is here to serve patients. And so they don't always get to benefit from this same element, but we do our best to make sure that we can provide compensation time for those whose jobs are not operationally critical over that period. There's a campus-wide picnic that'll take place Thursday of this week. It's a chance for our faculty, our students, and our staff to get out and to mingle and to relax and to have some time off while at the university enjoying some free food and beverages. Please take the time to come out and interact with your colleagues, see people that you don't work with on a day-to-day basis. It's so important that we learn about each other and what everyone does on this campus to help us be successful in our mission. Our vital speaker for September will be Lee Vermeulen. He is currently the CEO of the AACP. He's a leader nationally in pharmacy and setting pharmaceutical strategies. So this is a key person to come listen to. I ask that if you have the time, please come, please attend. This has really become a part of the university's brand. And we have several meetings going on right now. I think we're in a good spot, Tanya. I won't mention the name yet, but we're in a good spot where our Vitals program is going to get adopted nationally and get in front of about 600,000 clinicians across the United States to get CME and really build our name and our brand. And we'll have more on that to follow soon, but we have a follow-up meeting with that group. And this is all at no cost to the university. So it's really a big value for us. The Backyard Bash will be on September 5th. This takes place in the green area between the Village apartments. This is meant heavily for the students and recognizing them, but we invite others to all come on down to enjoy. There'll be food, there'll be beverages, there'll be some activity taking place. Last year, we had 400 show up to this event, 400 students, 200 signed up, 400 actually attended. We're expecting an even bigger group attending this time around. So if you can join us, this would be outstanding. And we're really fortunate that Mercy Health is sponsoring this event for our students on our campus. And then finally, we'll be having a partnership recognition. We've done this for all of our clinical partners. So far, we've been able to do this with Mercy St. Eve's, Altman Hospital, Akron Children's Hospital, and SUMA. And so this time around on September 19th, we'll have a big event for university hospitals to recognize their great clinical faculty who are teaching our students. And this will take place at the Drzezinski Sports Medicine Institute out in Beechwood. Week of Wellness is coming. This is a chance for our students to depress. It's hard to believe our first-year College of Medicine students are already done with some finals and moving so far into the semester that we're spending time trying to make sure that we're taking care of their social and wellness needs for them. The College of Pharmacy just started last week, as did the College of Graduate Studies, and they too will benefit from this. It's a chance to get them around the campus, to interact with all of us, to have some fun activities and show them it's not all about the really difficult courses they're taking, but that we are here to support them in other ways. And then finally, Grand Casino Night is coming. For those of you who remembered Casino Night in 2019, that was one of the events I was able to attend when I first arrived to this campus. It was amazing. Most of the events we go to feel a lot like wedding receptions, where we sit around a dinner table with 8 or 9 people that we know, and everybody else is doing the same siloed thing, and they watch somebody get up speaking to them like I'm doing to you now, and they eat some food, and then they figure out how they can sneak out of there fairly quickly afterwards. But this is a fun event. There are no tables to sit around. There will be places where you can lounge if you need to, but we bring in semi-professional dealers and roulette players, and we set up the tables, and it's a chance for you to engage, to have fun, to mingle, come with your friends. This will be a really great event, and it's a fundraiser for the university. We've already raised $75,500, and it's still about 2 months away, but we want this to be big. It was such an incredible event when our students ran it back in 2019. Then the pandemic hit, and we're finally getting back to bringing everybody together for this. So I hope that all of you can make it. We're looking to emulate the famous casino, Monte Carlo. And so out in front, we're asking some philanthropic donors and people who just happen to have the money to do this, much like Monte Carlo, to bring their ultra high-end cars so that you can see some Ferraris and Lamborghinis and other incredible cars that will be out there for you to be able to see and view, much like going into the big fancy casinos. And before we get to questions, who's sitting closest to, I don't know, let's pick F-107. Anyone? Row F-107? Well, let's figure out who you are. And when you're done, we got from the Browns, we have a Browns game ball that's been signed by Jeff Wright, number 22, who was a great linebacker at one time. There she is. Well, come up afterwards and you get a football for the Browns. And if you're not a Browns fan, we'll have to get you to be a Browns fan. And that's it. May I take any questions from the audience here first before we get to anything online? You know, when I started 5 years ago, I got riddled with questions constantly. So either you're tired of asking me questions or we're doing a good job and there aren't any lingering questions anymore. But communication is always a challenge at every institution, so I'm sure there are some. We got Dr. Moad, Vice Dean for the College of Medicine.
For casino night, is it true you're bringing in professional dealers because I beat you out of all your chips at the first one?
You did that last time. That is true. And my goal is if they're not professional, then they know how to stack it in my odds, because you did wipe me out last time. But that was the intent, right? Go out, have fun, spend the dollars for the chips you bought so that everybody can benefit. And that night will be the night that we find out who, through the lottery, is going to get the 6 days in Maui at the condominium there.
Perhaps a less fun question. Hi, Jackie Boyle, College of Pharmacy. Has there been any work done to reevaluate who qualifies for the faculty empowerment plan? Thank you.
So the faculty empowerment plan, thank you very much for your question on it, because there's been a lot of miscommunication on this. When we first wrote the plan up, including the full document, which was rather lengthy to support it, says that that plan is open to every full-time member of the university. Now, some people won't want to take it. If you're doing really, really, really well under the old RIP plan, which means you're already getting paid well above the 50th percentile in the nation, you may want to keep what you have. And anytime you convert over, you can convert over. When we looked at College of Pharmacy, I pushed this over when Dr. Kasmer was dean at the time. And he was a little resistant to it. He's like, well, I'm not sure anybody's going to want this. And I said, well, there it is. If they do, they can opt into the plan, because it was one plan for the university, because regardless of the college you're in, you do the same types of things. For a tenured professor, it's going to be research, it's going to be teaching, it's going to be some service. For non-tenured track, the research component is going to be a lot smaller, but generally that is what we do. Some people have titles where they may be an RFA director. In fact, Dr. Fleming is sitting right there, and I know she's an RFA director. And it does give the ability to give credit for those types of things too at the current level. Now, those with a PharmD degree wouldn't necessarily fit into this quite as well, because this is based on national data for PhDs and PhD equivalent educators. We do have some MDs in the College of Medicine, though, who opted into this plan. And it's open to anybody and everybody at the university at the faculty level. I have heard recently some people didn't think it was open to pharmacy. That's not true. It's always been intended for everybody. So it is there and it is available. Copies of the plan are available online in our policy portal so that you can see what it looks like. And we still have the calculator so that you can go in and play with the numbers and figure out whether you would want to move over or not.
Patty Thornborough, AHEC in the Department of Family and Community Medicine. I'm not looking specifically for any answer, but just some thoughts. As far as insurance, I was wondering if there's any kind of university cooperative that might be, that we could engage with in order to get insurance as a group and not just as our own university. And then secondly, has there been any thoughts about, again, going into different levels of insurance, like PPO, regular, HMO? I don't even know if HMO exists anymore, but that type of thought. Thank you.
We have. We've looked at it in significant detail. So we used to be self-insured. 2019, once again, when I came here, one of the first presents I was given within the first month was, we have $6 million in overspending on being self-insured that we didn't expect. What are we going to do about this? And that's when we switched over to being fully insured. Mary has pulled the data from all the state institutions, including the universities and the community colleges. And those that are self-insured all lose money at a greater extent than those who are fully insured by quite a large margin. So being fully insured is really what makes sense. And then you don't have to worry about these huge swings that can occur, especially in a smaller organization. So there are very few public universities that are still self-insured. 51% of them are using fully insured plans, similar to the ones that we have. Now, there are some that are doing it, and we have had discussions, and if it made sense to come together to benefit from scope and scale, we would consider it. But right now, it's a way to lose more money relative to being fully insured. We've also, and when I say 51%, I miscited that. 51% are fully insured and have high deductible plans. I think it's another 24% are fully insured. So the vast majority are fully insured now. High deductible plans mean instead of going for potentially a $2,000 deductible for an individual, that you might go to $4,000 or $5,000. That's really beneficial to the majority of the university and less beneficial to the few that are the high users. So it's a balancing act for us. We do need to make sure that we take care of our folks here. One. Two, we want to make sure that we maintain as much of the same current system of providers as you currently have, and that we get the cost down. So if we did move over to a high deductible plan, we would also implement something along the lines of either an HSA or an FSA so that you can put the dollars aside and have it so that you benefit in the same way. But right now, the first quote came back from our current carrier at 36% increase. Dental came back near over 60% increase. So we're looking at a different dental provider now, and they offer the same type of coverage that we're currently getting. So that's part of the balance that we look at. We're waiting on, as Mary said, we're waiting on a couple of more to bid today. And we know that one of them has already come in lower with the same or maybe larger network than you currently have. And also was more of a 17% increase instead of a 36. So we're hoping our current carrier is going to resubmit relative to understanding what the market's offering us. So a lot of work is going into this. Absolutely. We want to make sure everybody's taken care of. It's getting more and more expensive, and that's expected. But it's a challenge for every organization out there. Any other questions here in the audience? Seeing none, I'm going to look at what we have offline. In addition to branding, will there be signage with directions visitors are often lost, need someone to walk in there on campus? Yes. And in fact, the area that we run into this the most is the NEOMED Healthcare Clinic. I have escorted people from way over by the College of Medicine Dean's office to get where they were going. So Tanya and team are working on a number of different wayfinding measures to improve what we're doing. Much of what we had in the past was really subdued, and it fit an older model at this university that was looking to have everything very subdued so that you didn't see it stand out. When it comes to wayfinding, it really needs to stand out, and Tanya and her team are working on that. So the answer is yes. Do you have an update? NEOMED Healthcare, Dr. Boltry left, Dr. Bond left, and I was told Dr. Wickby is leaving this fall or may already have left. Yes, Dr. Boltry was actually volunteer time in that clinic, and it was a really small amount. And then we had the other physicians are part-time, very part-time. So we have signed on one of our NEOMED graduates who runs a very large practice out in the Mahoning Valley area, who is going to be coming on board initially 0.5 FTE or half-time with a trajectory to grow significantly to a full FTE here. We have also hired a brand new nurse practitioner who's already fully credentialed and should be cleared, as I understand it, from Canal tomorrow to start seeing patients. Same thing with our mental health capabilities and the counseling capabilities at the university. We received an update on that today. While there has been increased utilization by our students this last semester that we measured, which was the spring of 2024, it actually has not exceeded the amount that we do free every year, which is 6 visits per semester. We had 24 students at that 6, but none who went over. And we are right now recruiting, and I think we've got a key person identified to bring in a mental health nurse practitioner. Dr. Welton also spends some time up in the clinic for psychiatry. He does not see students, so the other mental health practitioners do. This is just an LCME issue with somebody who gives grades, not seeing students that they're taking care of. So we've got a great plan. We're growing. The trajectory over the last 3 years has really been unbelievable. We are approaching 500 patients a month, starting off with somewhere in the neighborhood of 19 3 years ago. And last data I saw showed that we get between 16 and 20 new patients per month signing up. So we're doing fairly well. We're growing. We do know that we're going to have to add on another full-time clinician sometime in the next few months to a year. But that clinic is going really well. And by the way, I get my healthcare at that clinic. And should you have any great interest in having me put a knife to you, I'm credentialed there now too as a surgeon, but I'm doing small lumps and bumps and lipomas and things that we can do in the clinic there. So I throw that out there in advance that if you say, no way, I want that guy touching me, then you know to go somewhere else. Any updates on the IT infrastructure, i.e. more staff, data warehouse? The IT infrastructure is being addressed by Ron. Ron's in the back of the room. He's doing a phenomenal job. He's completely restructuring his entire personnel force to do I don't want to say do a better job as though it's not been a good job, but always looking to improve. And so he is doing that. And of course, with the IT infrastructure, there's a physical part, which is why I'm not fading in and out today. Our team, hidden behind the scenes here, is doing a wonderful job. We've also revamped the IT infrastructure, and I think all but one of our main academic spaces, we still have some work to do in Meshel Hall, and we've already got a plan underway for the conference service center, both Cook Hall as well as the grand ballroom. So yes, well underway. These are not things we're letting go. The university is doing our best to attend to everything that needs to be addressed to help us fulfill our mission. Going back to healthcare, is the university going to look at tied system of employee cost? At this time, the division divisions, but someone who makes 51,000 per year is in the same category as an upper administrative faculty member, going by percentage of salary would be much more fair. Mary, do you want to address that?
I think I heard the question. So the percentage, is the question, should we tie the percentage that the employee pays to their compensation?
I think they're saying a regressive model instead of a evenly distributed or progressive model.
We haven't really looked at that. I mean, I guess we could talk about it, but we haven't really looked at a regressive approach to the split between premiums with the employer and the employee.
Yeah.
We could,
And that's not done that I'm aware of at any of the other state institutions.
I'm not aware. I'm not aware.
We'll look into it. We have all the data on the state institutions, but that becomes a redistribution of funds from somebody who makes more to somebody who makes less. But we can look and see what those numbers look like. There's always going to be somebody unhappy one way or another when that happens. But we've got to do what's fair and equitable. So we can look at it. Thank you for the suggestion. There have been budget cuts to most departments. Where did that go? Oh, okay. Well, there's actually not been budget cuts to most departments. There's been increases to almost every department. Mary showed that data when we started off. We have increased the budget year over year by a substantial amount over at least the last 3 years since the pandemic has waned away. And our revenues have increased pretty significantly over that time also. With JED and higher insurance rates, will there be any cost of living raise? The raises we received will be completely wiped out by JED and the insurance. We'd have to look at what those calculations are. They shouldn't be wiped out completely. The vast majority of people already pay city taxes, and there are deals where you now share it so that your city tax doesn't increase. We do know there are a few individuals, and in fact, 2 of them sitting right over there who came to me and said, oh, we don't currently pay a township or a city tax, so this is new to me. And most I could say is, sorry, there's not much I could do about it. We didn't start the JED. The JED was done to us, not with us. So it's something that pretty much every other university is currently paying. But we did look at the numbers, and it doesn't affect that many people. It's very few people at the university. So for me, I live in Aurora, and I was paying taxes there. Now with the JED comes to Aurora and says, yeah, you're not going to get as much from him before as you were. We're taking a chunk of it. So it actually doesn't change my net. And that's the way it is for most of you, except for those who are living in more rural townships where there's not a tax. And I get it. That does mean Rootstown, because Rootstown is a township that doesn't have a tax. But the benefit of the JED is for Rootstown. So I think the leaders of Rootstown thought this was the good trade-off. Instead of a taxing authority, was to create a JED authority, and they're the ones who led this. And any updates on dental school faculty recruitment and curriculum development? The dean of the College of Dentistry would be better at that than me, but he had given me an update today that they're interviewing somebody, I think tomorrow, for a chairmanship position. They've already selected a chair of another department. They do have some faculty on board. They've got a large number of potential faculty members who've written them asking to join. So it's not looking to be a recruiting problem for us. And their curriculum had to be fairly well defined just to get through CODA. So they'll make some, I'm sure, some tune-ups to it. Would that be fair, Dr. Beck? He's saying absolutely yes. The information they needed from us was new relative to accreditations in the past. They had I want to say a 2,000-page document that outlined every detail of the curriculum, how the grading would be done, how students would be assessed in the clinical enterprise, all the way to the electronic format they would use to log cases and to assess students while they're off our campus. So it was pretty significant, and we are a public university, so therefore it is publicly available information. but it's a great deal of content. And I suppose if you're really interested and have nothing better to do in an evening and read 2,000 pages of accreditation, you'd be welcome to do so. I rely on the dental team. I have read a significant amount of it and gone through the summaries, but it's a large amount of information. And that, I think, is all the questions that I've received online. So once again, thank you all for all the great work that you're doing. We are here working hard to try and make sure that we're taking care of you so that you take care of our students and the research enterprise. I hope you take advantage of coming together on Thursday with our picnic. Our whole team will be out there working the room, so to speak, to say hello to you and make sure we're hearing from you. And the strategy team will be out doing a survey for those who want to participate. We're trying to better understand how all of you envision the vision of the university. Do the current elements we have make sense? Because it doesn't do any good to have a vision and to have core values if they're really not reflective of what it is we do every day. So their team will be out there doing that. Don't normally get a chance to do this, but anybody in the audience, is there anything that we haven't shared that you think is critical before we meet next time? Dr. Amin?
Just
Go ahead.
okay.
You're hot.
Just wanted to let everyone know that everyone should have received an email going out from HR for flu shot clinics. So we will have flu shot clinics over the next month. And we also received a notification just about an hour ago that COVID vaccines will be coming in most likely this week or early next week. So we should have those as well. If you have already signed up for your flu shot clinic and would like to get the COVID vaccine at the same time, we will have those available.
And just to stave off any questions, COVID vaccines are highly recommended, but no, they are not mandatory. We still get questions periodically about that. Anything else? No? Well, thank you all very much. Stay, enjoy the cookies and the coffee, and look forward to seeing you next month.